This broadcast is brought to you by Colby Brooks with Century 21 Right Pace Real Estate and buyfrombrooks.com. Let Colby Brooks handle all of your real estate needs.
Now, Stan Morris reporting.
We hope you're having a great day. It's Stan Morris with you today in Jonesboro and across Northeast Arkansas. It's a few minutes before the press conference. Of course, we get the daily update from the Arkansas governor, and we want to bring that along to you live. But first of all, before that begins, we will give you a few updates, and the second the governor walks out, we'll take his feed live right here on NEA Report. Drive-through testing in Jonesboro starts today, or at least it did start today, because, of course, the testing itself, the time was from 7 a.m. to 9 a.m., but it will continue next Monday and Wednesday and Friday as well. It's at Walmart Supercenter parking lot, 1911 West Parker Road in Jonesboro. The mayor announcing that on yesterday, saying that the drive-through testing becoming available for the first time, of course, in Jonesboro today. But if you need to schedule an appointment to do this, you have to do it through that web address that I put up there on the full screen. DoINeedACovid19test.com, and you must have an appointment to get this done. There's a lot of information about that particular story. It's at neareport.com, so go there if you'd like an update on that. Our friends at NEA Reliant Healthcare teaming up with Dr. David Diffenay once again today to offer COVID-19 testing in West Memphis. This is the third day in a row they've done this, by the way. They continued it yesterday, but also it's been so successful they've had almost 100 people each day walk up and get tested. No physician referral needed, and you won't need an appointment for that. That goes until 6 p.m., and that's at 111 Dover, West Memphis. You can also get testing performed, and you'll need to make an appointment for this as well at Walnut Ridge Family Medical Clinic and Bono Family Medical Clinic, too. So as we get ready for the press conference with the governor, let's tell you where the numbers were yesterday. It's important to look at that because we're about to learn where they're at today. And so we will see how far it's changed in just a few moments. But yesterday's numbers look like this: 4,366 cases in Arkansas with 98 deaths being reported. And we saw 3,340 recoveries. The active cases went up yesterday. We saw 130 new cases overall, but with the recoveries, it did not mean 130 new active cases. Active cases went up to 928. And those are made up of this: 305 in corrections, 101 in nursing homes, 522 in the community, i.e. people out and about in your standard society. Across the United States, I can give you the numbers as of right now. These are current, and those numbers look like this. There are in the United States 1.4 million cases of the coronavirus. There is a mistake there with the number of deaths, as that is obviously incorrect, so I will take that down. But the number of recovered, 246,000, and the number of deaths in the United States, 86,386. Across the world, 4.5 million cases. That's the number that we're hearing from Johns Hopkins University, with 300,000 deaths and 1.6 million having recovered there. So it's a situation where, of course, in the different parts of the world, the growth has slowed, and other parts perhaps not so much. But with the social distancing measures about to be relaxed, at least to a certain degree, here in the United States, it's going to be more important than ever to keep track of that. By the way, that is the correct number on the screen now. The number of deaths in the United States, 86,386. So we're just a few moments away from the governor coming out and giving us the latest update. He'll also be joined by Secretary of Health, Dr. Nate Smith from the Arkansas Department of Health. As a matter of fact, we have the logo up right now from the live feed from the governor, just so you can see that right there. In the moment he walks out, we'll be bringing that to you live. Wherever you're joining us from Northeast Arkansas, we would like to know. Tell us where you're watching from in chat, and we'll give you a little bit of a shout out here if we can. By the way, thank you very much to Sherry Clifton, supporter, for joining us. And we appreciate everybody else for joining us as well. Brenda said your death toll went down from yesterday. So we'll check into that here in just a moment to make sure that there's not a mistake in the numbers, and we'll bring an update to you on the other end of the governor's press conference once he joins us here in just a couple of moments. Thank you very much for giving us information, by the way, on that. Sometimes numbers that come in on the website get changed from Johns Hopkins University, but we're also capable of making mistakes ourselves. I think you saw one of those already. And so that's something we'll go back and double check. We always try to provide an explanation, especially if we mess up. We don't always get that from the government, but there have been times when the numbers have gone down, like the number of recovered going down, which would make no sense except for an error having been made. Right. So appreciate you for making the comment. Hello to Janet from Walnut Ridge. Hello to Amanda from Monette. S.L. Robinson is watching today, and she is watching from Jonesboro as well. Lindsay from Paragould, good to see you. All of our supporters joining us, so we appreciate seeing y'all. Donna from Jonesboro. Samantha from Pocahontas. Joyce from McCrory. Kathy from Wynn. Pat from Lake City. Tina from Hardy. And Donna from Blytheville. It's good to see all of you. We really do appreciate you for joining us. And if you don't mind, give us a like or a share right about now, because that actually helps us get local news to more people than ever. That's pretty important, especially right now. It's a hard time for local businesses. It's a hard time for the news business as well. We're both of those things, but we do appreciate the community's support, and we're here to stay for sure. Teresa watching from Paragould, Tina from Hardy, Francis watching, Sherry from Peach Orchard, one of our supporters watching, and Donna and Bobby from Maynard. Good to see all of you. Glenda asks, how many cases in Craighead County? Good question, and I'll have that update for you right on the other end of the governor's update, which is going to begin any second now. So thank you for asking that. Glenda, watching from Bay, and Goldie too. Appreciate all of our friends in Bay, across Northeast Arkansas, and across the area too. Yesterday we actually had a viewer from North Carolina watching our live stream, and wherever you're watching from in Arkansas or across the United States or the globe, we're honored to have you here. So I am listening in, and I can hear some audio from the press conference, and here we go. The governor is live.
Thank you for joining me for today's COVID-19 daily update. I first want to recognize a letter that I received from someone from Springdale, Arkansas, that says, "Sir, I know that you have extended the deadline for state taxes, but with all you've been doing for the people of Arkansas, I feel like I need to pay my taxes now." And so I just want to express appreciation for someone who paid it early just to help the state of Arkansas out. I thought that was a nice letter. And I wanted to discuss, before I go to cases, just our economy for a second. After Monday, all retail stores in Arkansas are open for business, except one caveat, which are bars, and we will make an announcement in regard to those on Monday. But except for the bars, all retail stores in Arkansas are open for business. And that's just a sign as to how people are ready to work. They're opening up, and it needs to be emphasized that Arkansas is not under any lockdown order. We've never done a shutdown order in Arkansas or a stay-at-home order. We've taken appropriate precautions and carefulness, and we've given admonitions on social distancing. But Arkansas, as is indicated by the logos behind me, we are open for business here and ready for business in Arkansas. And while we take the virus very seriously, we recognize the need to work and make a living, and we want to continue to the next phase, to continue to lift restrictions on businesses and activities in Arkansas, but we have to be smart about it. But it's important to put it in perspective that while there are some restrictions out there, all retail stores in Arkansas are open for business as of next Monday. With that, let's go to the cases. First, yesterday we had 4,366 cases. We have, in the last 24 hours, a 97 increase in the number of our cases. That gives us a total of 4,463 COVID-19 cases. Of those 97 new cases, 79 are in the community. The rest are in the correctional facilities. In terms of hospitalizations, we have an increase of a decrease in 4. So going from 69 to 65 in hospitalizations, and there have been no new deaths here in the state as a result of COVID-19. We have still under 1,000 active cases, so it's 975. And the new cases, as Dr. Smith will talk about, is pretty well scattered across the state. Crittenden County did have an increase of 10 and Jefferson County 11. Beyond that, it's fairly scattered across the state. If we go to the other slide, this is the 7-day rolling average, which I like to see that flattening out again on the orange line. If you go to the next day, the next slide, this is the hospitalized. As I mentioned, we've had a decrease of 4, and so this is the trend that we like to see in Arkansas on hospitalization, which Dr. Smith and I have always said that it's hard to dispute hospitalization figures. If you're sick, if you're hurting, you go to the hospitals, and that measures it appropriately, and that puts us in a good position. The next slide, we've talked about testing, and we know that we've set a goal of 60,000 tests this month. This is a new website, arkansas.gov/COVID, where you can go, and there'll be a visual map with the designation that you can hit, and you can find out the closest facility that you can go and get your tests done. This is a Central Arkansas look, but you can go anywhere in the state, and so the INA helped design this for us, but this will be a useful tool, as you can see, with all the testing sites across the state that will be expanding, by the way, to help us to reach our goal of 60,000 tests in the month of May. And that brings me to the next graphic, which shows right here in the middle of the month, here on May 15th, that we are at 29,389 tests have been done. So 260,000 and beyond, as the Rocket Man says. But we're halfway there, and we look forward with all of the things that we have going of meeting that goal of 60,000 tests in Arkansas. That's our radar. It gives us an indication as to where we are. And of course, even with the increase in the number of tests that we've done, we're still under 5% even in the last 24 hours. And with that, before I recognize Secretary Hurst, I'll come back and set the stage for her in just a moment after Dr. Smith gives his report. Then I want to come back and talk about our state parks, our lodges, and the increase in business that we're seeing because of summer activities and the importance of our tourism industry. Dr. Smith.
Thank you, Governor. Before I go into the numbers, I'll point out that Eddie and I have matching ties that remind everyone to wash their hands. That's a very important part of preventing the spread of COVID-19. As the governor mentioned, we've had 97 new cases since yesterday. Of those, 18 are from correctional facilities and 79 are community. So our total is 4,463. Of those, 975 are active cases, and of those active cases, 322 are in correctional facilities, 102 are in nursing homes, and 551 are in the community. As the governor has mentioned, we currently have 65 hospitalized. That's a net decrease of 4 from yesterday. We have 9 on ventilators. That's a net decrease of 1, and we are still at 98 deaths, so no new deaths reported since yesterday. We have a total of 3,390 recovered. That's an increase of 50 from yesterday. Of the 79 new community cases, I wanted to give the top counties that are reporting from yesterday. We had 11 in Jefferson County, 10 in Crittenden County, 9 in Pope County, and those were related to a single facility, 7 from Pulaski County, and 6 from St. Francis County. I wanted to Also, talk about our testing numbers briefly. As the governor has mentioned, we are well on our way to achieving our goal of 60,000 for the month. Yesterday, we had 2,669 tests total with a positivity rate of 2.5%. Of those, 2,101 were from commercial labs, 217 were from the Arkansas Department of Health Public Health Lab, and 251 were from UAMS. So we're getting good contributions across all three. I want to talk a little bit more about testing in the context of elective surgery. We have had a requirement for elective surgery of getting that test done within 48 hours of the case, the beginning of the surgery. That we understand for some facilities has been a challenge. Although we still highly recommend getting that test done within 48 hours of the surgical procedure. Starting Monday, we will allow that to go out to 72 hours when 48 hours is not feasible. And the last thing I wanted to say about testing is, in addition to those sites on the map that the governor showed, beginning Monday, all of our local health units, about 70 of them that are open, will offer testing for COVID-19. We especially want people to come in if they have symptoms consistent with COVID-19, or if they believe they've been exposed to someone with COVID-19. But if they've been in an area where there's active transmission of COVID-19, even if they have no symptoms, we'd like them to come in and get tested. With that, I'll go ahead and turn it back over to the governor.
Today is the first day that our lodges and our state parks and our cabins are available for usage again. And so we're excited about this day that our state parks, in terms of the lodges, and our recreational facilities and cabins are open. And if we could go to the slide, it shows some statistics here. These are the occupancy percentages on some of our state parks. Devil's Den State Park, 67.85% occupancy. Crowley's Ridge State Park, 58. Lake Chico State Park, 51. Lake Catherine State Park, 43. And Morro Bay State Park, 41%. And so these are just a couple of examples of the volume of business and the interest of people in utilizing our great state parks. If you go to the next slide, it shows that our state park lodging reservations, 71% of those are from 71% are from Arkansas, and we have 29% from other state residents or from out of state. And so we're back in business. Our state parks are being utilized. We're encouraged by the reservations that are being made that are not that far down from 2019. And it illustrates that tourism is the second leading industry in Arkansas, and there's so many of our small businesses that are dependent upon this kind of commercial activity, utilization of our state parks, and so we're pleased with this. And the leader of that is Secretary Hurst, who's done a remarkable job under these challenging circumstances. But Secretary Hurst, if you want to come and shed a few more comments on this.
Thank you, Governor. As the Governor mentioned, today, May 15th, is our reopening day for our state park lodges and cabins, and we will also loosen other restrictions. I wanted to report that the public has received very well the ability to visit their wonderful state parks again and enjoy the out of doors. As of today, our occupancy rates are not totally dissimilar from where they were in 2019. What these numbers represent are available rooms, and so we are optimistic that this will be a very good May for us. We are taking great precautions as we consider the safety of visitors and our staff. For example, if you rent a state park cabin, you stay in it for 2 or 3 nights, we will let that room stay vacant for 2 or 3 nights after that, have the staff clean the room, let it stay open, and that is the safest way to approach renting that room out to the next customer. So we're taking very careful precautions to make our overnight facilities very safe for our visitors. I do want to point out that apparently it's fishing season. The fish are really biting right now, and our very popular marinas at state parks will be open starting today, and they have boat rentals and lots of fresh bait. So I encourage everyone to get out and do some fishing. I'm also very happy to announce that today we will reopen the East and West Summit Trails at Pinnacle Mountain State Park. They will open at 5 o'clock this afternoon. Included will be the Highway 300 day use area, and that includes the Base Trail, the Kingfisher Trail, and a portion of the Washita Trail. Everyone should know that parking will be limited to the designated parking lots within the state park, and our uniformed officers will be enforcing a safe physical distance for our guests. But we do look forward to welcoming the public back to Pinnacle Mountain State Park. Also, the Ozark Folk Center, another popular park, the Craft Village, will be open on Tuesday, May 19th. We've run all of those protocols through the Dr. Nate Smith and his team at the Department of Health, and we are going to safely reopen the Craft Village on Tuesday, May 19th. Another quick positive note I wanted to make sure everyone was aware of is that Arkansas was awarded almost $500,000 in funds through the National Endowment for the Arts, and these funds are to be sub-granted by the Arkansas Arts Council to nonprofit 501c3 organizations. The grants will range from $1,000 up to $15,000, and they can be used for a variety of uses, including staff salary support, fees for artists, facilities cost, and even adapting programs to address the new protocols. So unlike most Arkansas Arts Council grants, those grants do not require a cash match. The online application will be open Monday, May 18th, and the deadline will be the 29th. So for more information, I encourage you to go to the Arkansas Arts Council website. Thank you. Thank you, Governor.
Stacy, do we need legislative approval for that?
It's on the agenda. We've got the money. We just have to get appropriation.
Yeah, and that is, I will say, subject to legislative approval, and so that will not be out until we have the appropriate appropriations for that and we have the right legislative approval. With that, we're happy to take questions.
In the beginning, when you talked about retail stores being open, the retail stores were never closed, were they? I mean,
That's correct. Well, I mean, restaurants to dine-in service had been closed for some time. You had barber shops, which I would consider a retail shop, and so there were some. But part of what I'm saying today is everybody sees the national media and you see what's happening in other states about pressure to open up. I just want to emphasize that we are open for business in Arkansas. And sometimes people will walk by a store and say, well, it's not closed. And I think, well, the governor or Dr. Smith, closed this store down. Well, they haven't reopened, or they haven't opened just because they don't see the consumer demand yet. That's an individual decision of that particular business. And so I'm just reminding people that we didn't shut down. We are open for business, and even the ones that we had restrictions on, they are open for business. Everything in Arkansas effective Monday, except for that one item that we hope to announce some decision on Monday in terms of bars.
basically every type of business is allowed to be open starting on Monday. Starting on Monday, there's no business that's not allowed to be open, except for the
Retail. Retail businesses. We're still having to address camps, and those are businesses in some instances, but I focused on the retail is all open Monday with that one exception. Yes, listen.
I have a couple of testing questions, and one is about the active transmission that you mentioned about you could get a test if there was active transmission in the community. What defines active transmission? And my other question is about the Abbott Labs machines that the FDA put a warning out about
Dr.
yesterday.
Smith.
The active transmission, the way we're defining that is fairly loosely because it's a dynamic aspect. Certainly someone who's traveled from a state where they have a lot of transmission going on, but if someone was in a community where we know we've had a number of cases, we've mentioned the Forest City area, I've mentioned the top 5 counties. If there seems to be a number of positive cases being reported in a community, then we want people to come out and get tested in those areas. We're leaving.
Jefferson County has 11, that would be.
Yes, Jefferson County would be, now, you know, that could change. I mean, next week or next month, Jefferson County may not have any cases, in which case it would not be so important for people to come unless they had symptoms or a known exposure. But we're leaving that as a fairly loose definition because we want to capture all those who might be at risk. And then you had a second question?
Abbott Labs ID test.
Yes.
And those machines we're using, and what's the criteria?
The Abbott ID Now is a point-of-care instrument that you can actually take a swab, put it in the machine, and get a result in 15 minutes. It's a PCR test, and the advantage of it is that it gets results very quickly. The disadvantage, as it's turning out, is that there's a risk of false negative. It can miss cases, particularly early in infection. And we received 15 of those devices from Health and Human Services, and we've put them out in different parts of the state so that those facilities would have an on-site ability to do testing. That's been limited by the availability of the cartridges, and it's still a good test, but it has to be done in the right way on the right individuals. The test results are most likely to be positive if the person's infected, if the swab is collected at the point of care and put directly on the machine rather than being put in transport media and sent off someplace, because that dilutes the sample. And the other issue is screening people who have no symptoms. They have a lower amount of virus oftentimes, and they'll be less likely to get a positive result. So using it for those who already have symptoms that are suspicious of COVID-19 to confirm the diagnosis with a dry swab at the point of care, those are the situations in which the instrument performs at the highest level. Doing screening of people who have no symptoms, more likely to get a false negative result.
Nursing homes or?
Generally, we would not advise, based on what we know now about the Abbott ID Now instrument, we would not recommend using it for screening individuals who don't have symptoms. It would be best used as a point-of-care device for people who have symptoms that are consistent with COVID-19.
Nursing homes?
Well, if it's a nursing home resident who had symptoms, yes.
Nate, a couple things. What was the Polk County facility that had some cases pop up in it?
This is a substance rehab facility. I don't have the name of that.
Are we starting to see any recoveries in the corrections institutes?
Yes, actually, most of those in the Cummins unit have recovered.
Numbers on that?
I don't have those numbers with me today, but we can get those to you.
Yes, ma'am.
Are overnight visitors at State Park Lodging going to be screened before they enter?
You're talking about screening? Mm-hmm. You want to address that?
Yes, we will be screening and following the protocols as advised by the Department of Health. We'll also, if someone wants to travel from a hot spot from New York, those states, or New Orleans, Connecticut, New Jersey, I believe, are the 4 areas, they'll be required to quarantine for 14 days. So we are following all of the proper procedures.
Is there anyone remotely that has a question? Remotely?
Yes, Governor, this is Andrew with AP. Wanted to follow up on your comments yesterday about the concern that you saw in those 2 days prior in terms of cases and not being ready for phase 2. Wanted to see going forward, would there be a point where the numbers would be concerning enough for you to revisit the reopening that Arkansas has done, and if so, what would that benchmark have to be? And also separately, want to see if the state's received a plan or a proposal yet for Temple Live for their concert, whether or not they've gotten approval for it.
All right. First, in reference to where we are in terms of the phases, as you know, the White House Coronavirus Task Force has given great flexibility to the states, but we do pay attention to those guidelines, as guidelines, recognizing we've got to interpret in a way that makes sense for Arkansas. In the trajectory that we are going now and what I see in the future, I do not see any reasonable potential that we're going to go back on phase 1. We're not going to go back and start redoing and closing down things and putting in restrictions that we've already lifted. So I expect to stay in phase 1 until we're able to have confidence in our trajectory and that we're not going to have a resurgence that we can go into phase 2. Obviously, you can envision some theoretical opportunity in the future that there's an outbreak that is all over the state that you've got to retrench and do something different and tighten it up more. But with the information I have, the trajectory that we're going, with the confidence level that we have, I don't expect anything like that to happen. I expect us to stay in phase 1 and not retreating from where we are right now. We want to continue to open up, but we want to do it safely. And I think the guideposts that we're looking at would be both the hospitalizations, the positivity rate, our ability to test and respond effectively to any new cases. There's another question remotely.
Yes, Governor. This is Juliana Clifton over at Channel 5 in the River Valley, Northwest Arkansas. This is also just a piggyback question off the one that was just asked, but our neighbors over in Oklahoma did just open up phase 2 today. Their cases seem to have been much higher than ours over here in Arkansas. Do you want to comment on, why it might be okay for them to enter that phase and not Arkansas? And then also, have you considered maybe doing a regional approach of opening?
Well, we do work regionally, and I have a lot of conversations with the other governors, but everyone is in such a different circumstance in terms of their cases. As you pointed out, in Oklahoma, I believe they have over 250 deaths. And the last time I checked, we haven't had 100 yet. And so we're in different circumstances, but they have flattened it there in Oklahoma. So I just don't think you can make those comparisons very well. And I know that Governor Stitt is looking at his statistics, making the decisions and what they need to do as we are. And you can look at Texas and Louisiana and Tennessee and Mississippi, Missouri, all around. Everybody's going a different way based upon their own statistics. And I did forget, Andrew, you did ask me about the concert in Fort Smith, and they have submitted a plan for it. Have you acted upon that? That has been approved. Is that right?
They made some modifications that allowed us to approve it.
All right. So Dr. Smith indicated that they have made some modifications that will allow us to approve that for them to go forward. Thank you. All right. Is there another question remotely?
Yes, this is
yes.
always from Channel 5 in Memphis. Thank you so much for taking my question. I have two. I understand that the state is going to ramp up testing. However, the testing rate per 100,000 people is one of the lowest in the country. It's definitely the lowest in the Mid-South, far behind Tennessee and Mississippi. What do you say about the fact that the testing rate has been so low so far? And then I also have a follow-up question after that.
Well, you pointed out the reason we want to ramp up the testing. As to why it has been low in the past. It's the availability of equipment and supplies and capability. And, we have been able to do the testing that's sufficient for our healthcare workers, the top priority, as well as those that are symptomatic. I think it's given us a good sense as to where we've been in Arkansas, but we want to, as we have the capacity to ramp up, we set this goal. That's a very ambitious goal for this month, and I think that it will prove fruitful. We'll be able to make that goal. What's the second part of the question?
So why has it been more difficult for Arkansas to get testing than it has been for Mississippi and Tennessee, which are both, again, per 100,000 people, far beyond Arkansas?
Well, and the simple answer is that they were hotspots, and the resources went to hotspots. And so Mississippi had very serious outbreaks. They were able to get those testing capabilities. Tennessee, you can see the level of cases that they've had, the hospitalizations, and so they were a higher priority in terms of testing resources. If you look at Oklahoma, I don't believe they have tested more than we have, or Texas, and so that's part of the equation. I'm sure there's some others in some states that had a higher level of testing. They had in-house labs and a greater lab capability within the state. Dr. Smith, did you have anything to add to that?
During the first part of this outbreak, this pandemic, CDC guidelines were really to test initially only symptomatic individuals over the age of 65, and then opened it up to symptomatic individuals. The focus was on symptomatic individuals because they did want to use our limited testing capability as a nation in those areas where we had the most cases. We had fewer individuals with symptoms at that time. If we were still only testing those who had symptoms, Arkansas would still be at a low level of testing. Since we've been able to open that up to those with exposures or those living in areas where we know there's COVID-19 transmission, you've seen that we've been able to increase our testing per day. Last month we were maybe about 1,000 a day. Yesterday we were at 2,500.
Crittenden right now, it has one of the highest cases per 100,000 people. So would you consider that a hot spot? And why do you think Crittenden is seeing a higher incidence of COVID-19?
Crittenden County?
Yes, sir.
Crittenden County is right across the river from Memphis, which is a hotter spot. I've learned not to use that term hot spot around you guys because it's very open to interpretation. I made the reference to a hot spot with regard to Texarkana just because they had a higher increase of percentage of cases one day, and there were only 36 cases in the whole county at that time. So West Memphis does have one of the higher case numbers compared to all counties, but it's certainly not one of our top counties even in the state. So again, you can define a hot spot any way you want to, but I'm not using that term anymore. So don't quote me as talking about a hot spot. They do have more cases than perhaps some other rural counties in East Arkansas, but they have considerably fewer cases than Memphis across the river.
Per 100,000 people, they actually have more. So Crittenden County has 457 positive tests per 100,000 residents, while Shelby County has about 378. So that's about 100 more positive tests per 100,000 people than Shelby County.
Yeah, I think Dr. Smith answered that. Is there another question?
Yeah, Governor, this is Chris May from KTV in Little Rock.
Yes. The Little Rock question.
Governor, I've got a couple of questions, one for you and one for Dr. Smith, if I may. You mentioned that bars are still not allowed to open beyond Monday when all other businesses are. But there have been some reports floating around today that there were some bars in downtown Little Rock that not only had their doors open last night, they were serving crowds that weren't practicing social distancing and weren't wearing masks. I'm wondering if those reports have made their way to you or to the ABC, and if you expect any kind of enforcement action to take place as a result of that.
I'm not aware of that. That information has not flowed to me, and so I think you have to sometimes make a distinction. I mean, restaurants are open for dine-in service, and they have a bar. The only restriction is you can't sit at the bar as is you have to be there for dine-in purposes. And so, Doctor, I haven't heard any complaints. Have you had any?
I've not heard those complaints. If you're aware of those, please call in to the Arkansas Department of Health and make those as a complaint so we can have specifics and we can investigate those.
Okay, thank you. Dr. Smith, yesterday the CDC issued a health advisory for what they call a multi-system inflammatory syndrome in children that's been associated with COVID-19. There have been cases in several of our border states, Mississippi, Louisiana, Texas, Missouri. Is the department aware of any instances of this in children in Arkansas, either in the past or currently? What's your assessment of that condition, and what would you want physicians and parents around the state to know about that?
We have not had, to my knowledge, any cases of this inflammatory Kawasaki-like complication of COVID-19 in our state, in Arkansas. Of course, we've had very few cases in children in our state, but this is something that's of concern. It's something that's not been previously recognized and something we need to watch out for. We do know that children are less likely to be hospitalized and have serious complications, but this is something different, something we need to watch for, and also be aware that even though older Arkansans are more likely to have serious complications and deaths, people of any age can have serious disease from COVID-19, and it can even result tragically in death.
Any other questions? We got Andy.
I guess this might
Yes, Mercedes McKay with Channel 11.
This might be a question for Dr. Smith then.
Just a second, Channel 11. We got one question at the table, then we'll come to you.
In terms of testing at the units for people who live in areas where there's active transmission, who in those areas should go get tested? Like if they don't have any symptoms, but they only qualify because they just live in that area, what type of people should go get tested?
Again, the priority is for those who have symptoms, those who think they've been exposed to someone with COVID-19, but if we do have someone who's living in an area where there have been quite a few cases and they're concerned, then they should come in as well. They won't be turned away. As long as we have resources and are not overwhelmed with individuals on one particular day, they will be tested.
And then to Channel 11 remotely.
Yeah, so with testing being ramped up and the goal of 60,000 by the end of May, how quickly are those results coming in? So when y'all talk about the positive tests every day, are those from the day before? Are y'all getting results back daily, by the hour, or does it take several days?
Well, in terms of the commercial labs, there's always been 24, 48 hours lag time in us getting the results in. They first go to the doctor and then they will come to the health department. And so there's a lag time with the commercial labs. That's been decreasing, and some of it depends upon which lab that you go to. In terms of the Department of Health and UAMS, those statistics come in very, very quickly. And so it just depends upon the method of testing that we accomplish. And just like the other day, we had a large amount of testing done in a prison facility. It took a couple days for all those tests actually to be accounted for. We give the results for what we have completed and finished, and we can account for, even though we might know there's going to be some more coming in the subsequent days. Is that helpful, or do you need more on that? Any other questions?
Rapid fires. Have any of the casinos been officially okay to open back up yet?
All three.
And then the decision Monday, will that include restaurant bars as well? Or is that just sort of
No, it would include restaurant bars. So there's some restaurants like right now would be doing in-service dining, but they have their bar that's empty. So it would include anyone that had a bar in their facility.
And then final thing, southern Arkansas seems to be pretty clear for the most part. I mean, this is more for you, Dr. Smith. I guess what's been working down there, considering North Louisiana has been a little high?
In the northern part of Louisiana, we know there are quite a few cases in Shreveport, but most of the border counties have not been that different. When we've looked at those, we've not seen a big difference between southern Arkansas and northern Louisiana.
Final question.
So yesterday, Dr. Bright testified for the House of Representatives on PPE coming from overseas, and his concerns that some of it showed to be only 30% as effective as U.S.-made PPE. So I was wondering, we seem to have enough. Have we had to return any? Has any of it been, have we been directed by the FDA to say, this turns out not to be any good, don't use it, or?
I would have to look into that question more. I'd have to talk to all the procurement people to be 100% correct on that, and we can try to get back with you on that. All right, with that, just let you know that we don't anticipate having anything over the weekend. If that changes, we will let you know. And then secondly, Monday we'll be in Forest City, and then Tuesday we will be focusing on nursing homes and probing into that whole area statewide just a little bit more. I think it would be instructive for us, and really express appreciation to all the nursing home workers and those that are taking care of those in the facilities that do a great job. Thank you. Have a good weekend.
A lot of stuff to unpack out of that. So thanks everybody for hanging out with us on NEA Report. That was the Arkansas governor's most interesting press conference, just from a purely news point of view, up until now throughout any of these. For starters, you had the Buzz Lightyear graphic. That's kind of how it began, which was unusual to say the least. And before it was over, a reporter from Memphis decided to challenge the governor with several questions, and he was clearly left unhappy. If you've not watched these before, that's probably the least happy he's appeared thus far. So very interesting to watch that entire thing. Let's update you now on the numbers out of the press conference. 4,463 cumulative cases. That's an increase of 90 today. 3,390 recoveries. That's an increase of 50. So, in other words, we went up 40 active cases based on that, because there were no new deaths today, and that's good news to always report. We like to be able to say that. The number of active cases, 975, with 322 in corrections, 102 in nursing homes, and 551 in the community. We updated the numbers across the United States from Johns Hopkins while we were listening to the governor. They went up a little bit, 1.427 million. With 86,000 deaths, and I did verify that once again, and 246,414 still showing as the number of recoveries. Across the world, 4.5 million cases of the coronavirus, with 305,000 deaths and 1.6 million recoveries. One of the big things that was in that press conference was a discussion about testing in Crittenden County, where some would say it's a hot spot. I would certainly say that Memphis TV station would agree with that, saying there were over 400 cases per 100,000, based upon the numbers in Shelby County, where there are only 300 cases per 100,000. Those are different. But there are other factors you might consider with that too, such as the number of people in Crittenden County who work or travel to or commute to or through Shelby County, Tennessee, which is a much larger metropolis area compared to, well, most any city in Arkansas, to be quite honest. So there's a fair question about that, but there's also probable explanations for that may be logical. However, we want to mention to you that one of the most important notes to come out of this was when the Secretary of Health stated that they're hoping for people that are in areas that have seen activity to get testing. And Crittenden County has to meet that if any county would. Well, guess what? Today, they are doing drive-through and walk-up testing in West Memphis, Arkansas. Right? It's perfect time. It's the third day in a row they've done this. The first 2 days, they actually had an increase day over day in testing there. They were at 100 yesterday, I believe was the number that Jeremy Bergman gave me, and it was in the high 90s the day before. I think maybe 98, but I'm not totally sure. However, good news is you still have time to get over there and do that. You don't need a physician referral. You don't need an appointment. You can get over there, get your results 2 to 5 days. Generally speaking, and they're testing for both antibodies and the active virus. And based on the directive today, just being in an active area warrants testing, and you should get testing. And the hope is for us to get more testing. So it's good work being done by Dr. David Diffenay and NEA Reliant Healthcare over there, and we hope that everybody in the area is at least aware of that. They're third day in a row, by the way, of doing this, as I've said. And so that's until 6 p.m. If you follow the NEA Report News Tips group, we'll always keep you up to date if they have more of those that are coming up. Drive-through testing will resume in Jonesboro on Monday, 7 to 9 a.m., but that's at the Walmart on Parker Road, and you have to go to doineedacovid19test.com to go through that. Bono Family Medical Clinic and Walnut Ridge Family Medical Clinic also doing those tests, so give them a call if you'd like to make an appointment. And go see them and get that taken care of. We had a request for numbers across Northeast Arkansas as far as what the exact numbers were yesterday. That's the best I can give you because the map, at least as of last check, had not yet been updated with today's numbers. It will be later tonight, and once it is, we'll have that at neareport.com. But the update that we heard just a moment ago would change some of these numbers, and we want to point that out. However, the numbers as of yesterday looked like this, and Craig had 127, Greene 24, Lawrence 72. Some other counties here, I'll just hit on those real quick. In Randolph, 22, Clay 3, Sharp 36, in Poinsett 25, Mississippi County 55, Crittenden County 219, but they did confirm they had 10 more there today, so that means they're at 229 as of today. That's the only county out of these numbers I just showed you that are going to have current numbers because the other counties have just simply not yet been updated, but they will. The Arkansas Department of Health, I'm going to refresh it just on the off chance that they did update it, and they did. Okay, so here we go. They did just update the website, and I'm going to give you the new numbers. Let's see if I can just pull up the map. That'll probably be a lot easier than actually trying to just read these off. So hang tight with me. We're going to add a remote connection here, possibly crash the live stream. If it doesn't crash the live stream, oh, we're here. We're going and it's good. So right now, the Arkansas Department of Health's map looks like this. Craighead County at 130 positive cases, 83 recoveries. Poinsett County at 25. Greene County at 24 with 21 recoveries. Lawrence County at 72 with 51 recoveries. And Randolph County at 22 with 21 recoveries. We're seeing in Sharp County 37 positives with 6 recoveries. They've had a nursing home outbreak over there, but as far as I've been told by some people that are on the ground and close to the situation, most people have been non-symptomatic, only a few showing symptoms at all. So maybe most of the cases will be asymptomatic, we hope. Independence, 23 positives, 15 recoveries. Jackson, 1 and 1. So in Cross County, 35 positive, 23 recoveries. And just as we told you with our math, thanks to my fantastic math teachers in Pocahontas, I almost said science teachers. How embarrassing that I even admit to it. We got it right. 229 positive there. 188 recoveries in Crittenden County. And of course, the question of why is Crittenden County so much more of a hot spot than some other counties nearby. Jonesboro and Craighead County seeing 130. St. Francis County with the prisons issue there, 333. She didn't really bring that up, the questions. But Crittenden County is at this number because the Johns Hopkins map, as you're going to see right here, clearly shows that Memphis and Shelby County are seeing a major outbreak. You can already see it on the map right here, and that's without even any of the border being shown. I do not know my geography that well. I just clicked the big red dot where there are 3,542 cases in Shelby County, Tennessee. Major hotspot, if you could ever define one, at least relative to our area, right? The closest nearby that's even comparable would be in Nashville, 3,700 cases. In St. Louis, 4,100. Some other communities in Orleans, you've got 6,787. Dallas, 6,800. So comparably to those, you're seeing a larger number, because in Arkansas, the nearest we have to that is going to be Pulaski County. Crittenden County next door has 200. Lincoln County, 949, as it's shown right here. Some other counties there, nowhere near it. All right, everybody, we do appreciate you for joining us today on NEA Report. Thanks so much for watching, and if you think we did a decent enough job, well, we would really appreciate it if you would consider clicking like or share right about now. You can become a supporter too for 99 cents, and we do exclusive fun stuff for supporters every week. It's just basically exclusive broadcasts that you would not get anywhere else. It's a real fun thing for us to do, to give back to the people that make local news possible. Literally, those people are the reason we're able to keep going here, and we're forever grateful to them. I'm Stan Morris in Jonesboro, and now you're up to date from NEA Report. We won't be doing press conferences this weekend, according to the governor, so that means that we will be back on Monday, unless breaking news breaks out, and then we'll break in. Stay safe, stay responsible, keep the masks on if you're going in public around other people, and be healthy, and be nice to other people too. Have a good weekend.